Welcome everyone. Today's topic of discussion is plasmonic nanoparticles for cancer treatment. Plasmonic nanoparticles, actually plasmons, this thing you can study in the subject of particle physics. Plasmons are actually quasi-particles, and here we are talking about plasmonic nanoparticles. And for cancer treatment, normally gold or silver are used as nanoparticles. Okay, so what is actually plasmons? What are actually plasmons? Plasmons are quasi-particles. Means this phenomenon can be observed in case of, if say, for example, there is an interface of a metal and dielectric surface. So at the interface, this phenomenon can be observed. What is that? When light interacts, means when light impinges upon that interface, then there is a collective oscillation of the electrons, free electrons, collective oscillation of the free electrons. And that collective oscillation of free electrons are known as plasmons. So here in the treatment for cancer, those property of plasmons are used. So here what is done? Either gold or silver, these are metals, you know, gold and silver both are metals. Aluminium is also metal, but in case of cancer treatment, aluminium is not used. Only gold or silvers are used as nanoparticles. And those nanoparticles do the same thing. Means plasmonic effects are also observed in case of these nanoparticles. Here, these nanoparticles act as that required metal surface. So when light interacts with these nanoparticles, actually in case of cancer treatment, normal light is not used. In case of cancer treatment, infrared light is used. And you know that for a specific wavelength, resonance can be observed. And actually, this property of resonance, this is used for the treatment of cancer. When resonance occurs, in that case, actually what happens means when light impinges or for the incident light, means when light interacts with the nanoparticles, a part of light is absorbed by the nanoparticles and a part of light is scattered by the nanoparticles. So the part which is absorbed, the part of light, the part of infrared light which is absorbed by the nanoparticles are converted into heat. Means that light energy is converted into heat. And that heat is used to destroy the cancerous cells while sparing the healthy tissues, healthy surrounding tissues. Means surrounding healthy tissues are spared. Means this is actually a targeted therapy. Only cancerous cells can be destroyed by using this technique. Technique is what? Technique is here use of plasmonic nanoparticles. That means what is the requirement? Requirement is light source is required and nanoparticles are required. So nanoparticles are introduced into the patient's body. And one more requirement is there, how the nanoparticles will recognize the cancerous cells. And for that purpose, nanoparticles are engineered properly. Okay. So, you know that cancerous cells, in that case, overexpressed receptors are there. So, nanoparticles are designed that way. Okay. Antibodies are there with the nanoparticles. And those antibodies act as ligands. They can easily bind to the cancerous cells. But those nanoparticles won't bind with the normal cells, only cancerous cells. So when nanoparticles are introduced into the patient's body, those nanoparticles ultimately reach to the target site, means where cancerous cells are present, and they bind to the cancerous cells, and thereafter light source is used. Normally, in the treatment for cancer, optical fibers are used. By using optical fibers, infrared light are sent, and using and I have already mentioned in the very beginning that this is nothing but the interaction of light and metals. Here, metals are nanoparticles. So ultimately heat is produced, and that heat destroys the cancerous cells. That means it is a kind of a targeted therapy. What is the advantage of this targeted therapy? Advantage is that healthy tissues means reduced side effects are there, because healthy tissues are spared. There is no damage to the healthy cells or healthy tissues during the treatment procedure. So, and this process is minimally invasive, and this therapy can easily be controlled, and it can be monitored easily by using ultrasound or MRI. Okay, actually light is sent that way by using ultrasound or MRI technique. Those things are used. Okay, so anyway, so main concept is what? Here main concept is by the use of plasmonic effects or plasmonic quasi-particles. The property of plasmonic quasi-particles, this is used here. Okay, so free electrons are required, and those free electrons are delivered by those nanoparticles, that is gold or silver, which are introduced into the patient's body. And those free electrons interact with the light and produces heat, and that heat destroys the cancerous cells. Though you won't find widespread use of this technique at present, because clinical trials are underway. No doubt there is a beacon of hope. Scientists are making their efforts to make cancer treatment more effective and more compassionate as compared to the traditional therapies, traditional cancer therapies. Okay. So advancement is required, that is known to you, I think. Many attempts are being made simultaneously, and this is one of those attempts. Okay. Here plasmonic nanoparticles are used. So this is a kind of a photothermal therapy, because light is converted into heat. That's why the name the term photothermal is used. So this is a kind of photothermal therapy. Photothermal therapy for cancer. Okay. Okay. So this was all about today's video. Plasmonic nanoparticles for cancer treatment. Okay, and if you have any queries, you may write in the comments below. Okay, anyway, so this was all about today's video. This is now the end of this video. Thank you for watching this video.